Good morning, everybody. We're going to wait just a couple minutes to see if more people. I know some people are still logging in online, and we may have more people joining us here at the table. So we're just going to wait a couple more minutes before we get started. Good morning, everyone. Okay, good morning, everyone. We're going to go ahead and get started. This is the first meeting of the Complex Rehabilitation Technology and Wheelchair Repair Advisory Council, as created, excuse me, out of Public Act 24-58. My name is Jonathan Slivka. I am an executive assistant in the Commissioner's Office at the Department of Aging and Disability Services, and I will be serving as one of the co-chairs of the council. We will have opening remarks first from our legislators. First, the chairs of the committee, Senator Lesser, if you're on.
I am, Mr. Chairman. Thank you so much for convening and serving on this critically important advisory council, and I want to thank you and all of the members for agreeing to serve on it. This past year, in response to a series of complaints from wheelchair users, the Human Services Committee, on a bipartisan basis, passed legislation, first of its kind in the country, intended to provide some basic consumer protection for wheelchair users. The purpose of this task force advisory group is to monitor the implementation of the law, to get data on timeliness from the industry, and to empower legislators to understand if the law that we passed is working, or if we need to come back and pass additional legislation to beef up those protections. This information will be extremely useful to myself, to the members of the Human Services Committee, and I suspect as well to our colleagues over at General Law and the other committees that are concerned with this issue. As always, we are here to help. So if there's anything that the committee can do to assist your work, please call on us. We are happy to work with you to make sure that your work is successful. And if it's not, for whatever reason, either because you don't have access to data or whatever else you might need, please let us know that as well. We want you to succeed. Thank you very much, and wish you the very best of luck.
Thank you, Senator Lesser. Representative Gilchrist.
Good morning, everyone. Thank you so much for taking the time to participate on this important committee. When this issue got brought to the senator and myself, I'll only speak for myself, just taken aback at how long this had been an issue, and what individuals are experiencing in our state. And so there have been so many fruitful conversations thus far that got us to this point between the industry and the advocates. And so I'm just very optimistic to see where this will go, and appreciate you committing your time and your energy to working on this with us. So as the good senator said, please know that we're a resource for you. If you need any information, any data, any access to various agencies, we're here to support, and look forward to just getting continuous updates, because this is an issue that isn't just a one and done. We didn't fix the problem. We've begun to address it. And so I look forward to learning from you all how we can continue to move the state forward. Thank you so much.
Thank you, Representative Gilchrist. We will now hear from the ranking members of the Human Services Committee, starting with Senator Seminara. I believe you're on mute, Senator.
Sorry, I was in a section where my reception wasn't very good. So happy to be here with you all. Congratulations for being selected as members of this committee, or this task force, I should say. I look forward to the good work that you will do on an ongoing basis, and look forward to hearing from all of you updates and how things are going. And as it was stated earlier, this was just the beginning. The passage of the wheelchair bill is just the beginning. We hope that we will continue to make progress on this very important issue, and look forward to helping in any way that I can. Thank you so much.
Thank you, Senator. And finally, Representative Case.
Thank you, Jonathan, and it's so good to see you there chairing this committee. It's been a long haul with the Senator Seminar, having the committee last year and working through with so many members that are here. This is a group that's just that needs to look through and see that we put forward is things even more workable in the state of Connecticut. I think we've come a long way. We've opened the eyes of a lot of people. I know the governor's mentioned it to me when I met with him. And we're here for a resource. I know we're not sitting on the committee with you, but we're here for you. We will be watching, we'll be seeing what's going on, and hopefully if there's things that need to be strengthened or worked on through the Human Services Committee, we can do that once you guys report out on how things are going. So with that, good luck, Jonathan, and we're here for you.
Okay, thank you, Representative Case. Thank you all for being here this morning. We appreciate it. So now we will we'll have an introduction of all of the members of the council. I know many of us are on Zoom, and several of us are here in the room. I will introduce myself again. I'm Jonathan Slifka. I'm an executive assistant in the Commissioner's Office at the Department of Aging and Disability Services. And again, I will be serving as one of the co-chairs for the council going forward. Why don't we start with the folks in the room? We'll start with Mr. Taubman.
Thank you, Mr. Chairman. My name is Sheldon Taubman. I'm the litigation attorney at Disability Rights Connecticut. I've been working on this issue for a couple of years. Before that, by the way, I was at Legal Services, New Haven Legal Assistance for 30 years. And in that capacity, I had several occasions to work on access to durable medical equipment, and particularly custom wheelchairs. So I'm pretty familiar with the issue. Thank you for chairing this group, and I look forward to what we can accomplish. Thank you.
Thank you. Ms. Emerald.
Hi, I'm Maureen Amiro. I am representing the Citizens Coalition for Equal Access. It is a group that works for disability accessibility from anywhere from sidewalks to medical diagnostic equipment. And also I am a member of the Wheelchair Repair Coalition, Reform Coalition, rather. Thank you.
Thank you. I missed one of our other members. My apologies. Ms. Johnson, would you like to introduce yourself?
Ms. Johnson is not verbal, but she's typing out something. Okay.
Should we move and wait and come back to you? Okay, happy to do so. Ms. Garland.
Hi, my name is Farah Garland, they, them. I am a longtime disability and queer rights activist and community and political organizer. And I'm a director, board member of the Connecticut Silk and chair of the Connecticut Wheelchair Reform Coalition, and utterly delighted to be here today. Thank you so much.
Thank you. Mr. Frizio.
Good morning, everyone. My name is Adam Prizio, and I'm a senior staff attorney with the Connecticut Office of the Healthcare Advocate. I'm very happy to be here, in part because earlier in my career, I worked in upstate New York for an independent living center called the Center for Disability Rights, where I advocated for the integration and independence of disabled people. And in that role, I also became involved with a group called ADAPT, which did we did nonviolent civil disobedience toward that end, and it was a great time in my life, and I'm very pleased to be back in this work. Thank you.
Thank you. Ms. Johnson, are you ready to go? Okay, great. Thank you very much. Okay. Mr. Roop, if you'd like to introduce yourself.
Sure. Good morning, everyone. Pleasure to be here on the council. I'm a wheelchair user, paraplegic for over 20 years. Look back to giving to the council and, make sure that equal access and timely repair is offered to all individuals. Also a occupational therapist and assistive tech professional too. It's my passion to really improve equal access and wheelchair repair in a timely manner. So pleasure to be here. Thank you all.
Thank you. Okay, Mr. Morgana.
Good morning, everyone. David Morgana here, long-term disability advocate, and I'm happy to be part of the council. Thank you.
Thank you. Ms. Rasko.
Good morning, Diane Rassicott, Vice President of Payer Relations for NSM, also representing some of the industry and been part of this work group since the beginning. Thank you for allowing me to be on this committee. Appreciate it.
Thank you. Sorry, I mispronounced your last name. Okay.
No worries, no worries.
Okay. Ginny?
Yes, good morning. I'm Ginny Mahoney, and I'm the Department of Social Services designee. I'm in medical policy, and one of my primary responsibilities is durable medical equipment. And I do appreciate the opportunity to sit and be a part of this wheelchair repair task force. Thank you.
Thank you, Ginny. Okay, Joe?
Yes, good morning. Thank you for allowing me to be on this task force or this committee. And I'm an advocate for Independence Northwest, one of the 5 state independent living centers here in Connecticut. And I've been a wheelchair user for over 20 years now. And I look forward to hopefully making some additional changes to this law so that we can get wheelchairs repaired in a timely manner. Thank you.
Thank you. Shelley? Okay, Shirley?
Good morning, everyone. I am Shirley Skyers Thomas, the Deputy Commissioner for Department of Consumer Protection, and I was on the task force last year, so I'm really pleased to be a part of the conversation again. Look forward to the good work that we will do together. Thank you again.
Okay, thank you. All right, so what I'm going to do is do a review of the public act to read it into the record, and then we will move forward with a vote on the co-chair, which was one of the things that we have to do before we move on with our work. So Public Act number 24-58, it's an act concerning wheelchair repair requirements. Be it enacted by the Senate and House of Representatives in General Assembly convened as used in Section 2 of this act. Authorized wheelchair dealer means any company doing business in the state, selling or leasing wheelchairs, including complex rehabilitation technology wheelchairs. Complex rehabilitation technology has the same meaning as provided in Section 17B-278J of the General Statutes. Complex rehabilitation technology wheelchair means a specialized, medically necessary manual or powered wheelchair individually configured for the user with specialized equipment that requires evaluation, configuration, fitting, adjustment, programming, and long-term maintenance and repair services. Consumer means the purchaser or lessee of a wheelchair, including a complex rehabilitation technology wheelchair, irrespective of whether the purchase or lease of the wheelchair is funded in whole or in part by the consumer or privately or publicly funded health insurance. A timely repair means as soon as practicable, but not later than 10 business days after the date of request for repair from a consumer, provided A, the consumer makes the wheelchair available, B, any prior authorization required from an insurer has been acquired, and C, any time spent waiting for prior authorization from an insurer or for delivery of necessary parts ordered for the repair by an authorized wheelchair dealer shall not be included in the 10 business days. Number 6, wheelchair means a manual or motorized wheel device that enhances the mobility or positioning of an individual with a disability and includes a complex rehabilitation technology wheelchair. Section 2, an authorized wheelchair dealer shall timely repair a wheelchair, including a complex rehabilitation technology wheelchair sold or leased by such dealer in the state. An authorized wheelchair dealer who sells or leases a complex rehabilitation technology wheelchair in the state shall provide timely repair of such wheelchair at a consumer's home upon request. B, an authorized wheelchair dealer shall maintain an electronic mail address and a phone line for consumer repair requests that are accessible each business day and capable of receiving and recording messages. The authorized wheelchair dealer shall respond to a request for wheelchair repair not later than 1 business day after the date of request, and 2, order parts for repair not later than 3 business days after assessing the need for the repair or after receiving prior authorization from an insurer for the repair. C, on and after July 1st, 2024, the Office of the Healthcare Advocate, in consultation with the Department of Consumer Protection, shall maintain a phone number and electronic mail address to be posted conspicuously on the internet websites of the Office of the Healthcare Advocate and the department to receive and record complaints regarding timely repair issues. Not later than January 1, 2025, and annually thereafter, the Healthcare Advocate shall submit a report to the Joint Standing Committees of the General Assembly, having cognizance of matters relating to general law, human services, and insurance regarding the complaints received and recorded pursuant to this subsection. Section D, not later than December 31st, 2024, and annually thereafter, an authorized wheelchair dealer that contracts with the Department of Social Services to sell or lease wheelchairs to Medicaid recipients shall submit a report to the Commissioner of Social Services and the Advisory Council established pursuant to Section 4 of this Act regarding repair of such wheelchairs. The report shall include, but need not be limited to, minimum, maximum, and average times from the date and time of a repair request for the authorized wheelchair dealer to 1, respond, 2, conduct a repair assessment. A, in the home or other community location, B, remotely, or C, at a repair facility. 3, request any necessary prior authorization from the Department of Social Services and receive a decision from the department on such request. 4, order any wheelchair parts needed. 5, receive delivery of any needed repair parts. And 6, complete repairs. A, in the home of other community location, B, remotely, or C, at a repair facility. Section 3, Section 17B-278I of the General Statutes is repealed and the following is substituted in lieu thereof. A, as used in this section, customized wheelchair means a wheelchair built, designed, or outfitted for a Medicaid recipient with a physical disability unable to achieve maximum mobility with a standard wheelchair and includes a complex rehabilitation technology wheelchair. 2, authorized wheelchair dealer, complex rehabilitation technology wheelchair, and timely repair have the same meanings as provided in section 1 of this act. And 3, medically necessary has the same meaning as provided in section 17B-259B. Customized wheelchairs shall be covered under the Medicaid program only when medically necessary, and a standard wheelchair does not meet an individual's needs as determined by the Department of Social Services. Wheelchair repairs and parts replacements may be subject to review and approval by the department. Refurbished wheelchairs, parts, and components shall be utilized whenever practicable. The Department of Social Services may designate categories of durable medical equipment in addition to customized wheelchairs for which reused equipment, parts, and components shall be utilized whenever practicable. B, notwithstanding the provisions of subsection A of this section on and after July 1st, 2024, the Commissioner of Social Services shall not require a new prescription or prior authorization for the medically necessary repair of a customized wheelchair unless the original prescription for such wheelchair is more than 5 years old. C, the Commissioner shall seek any federal approval necessary, including amending the Medicaid state plan or applying for a Medicaid waiver to implement the provisions of this section. Section B, the Commissioner pursuant to section 17B-10 may implement policies and procedures necessary to administer the provisions of this section while in the process of adopting such policies and procedures as regulations, provided the Commissioner prints or posts notice of intent to adopt regulations in the Connecticut Law Journal on the e-regulation system not later than 20 days after the date of implementation. Policies and procedures implemented pursuant to this section shall be valid until the time final regulations are adopted. Section 4, effective July 1, 2024, there is established a complex rehabilitation technology and wheelchair repair advisory council to monitor repairs of wheelchairs, including complex rehabilitation technology wheelchairs as defined in section 1 of this act, and to make recommendations concerning improving repair times. B, the advisory council should consist of the following members. 1, 2 appointed by the House and Senate chairpersons of the Joint Standing Committee of the General Assembly, having cognizance of matters relating to human services, one of whom is a consumer who uses a complex rehabilitation technology wheelchair purchased, leased, or repaired under the Medicaid program, and one of whom is a representative of the state advocacy system for persons with disabilities, established pursuant to section 46A-10B of the general statutes. 2 appointed by the House and Senate ranking members of the Joint Standing Committee of the General Assembly having cognizance of matters relating to human services, one of whom is a consumer who uses a complex rehabilitation technology wheelchair purchased, leased, or repaired under a private health insurance policy, and one of whom is an authorized wheelchair dealer as defined in section 1 of this act. 3, 2 appointed by the House and Senate chairpersons of the Joint Standing Committee of the General Assembly having cognizance of matters relating to general law, each of whom is a representative of an organization that represents persons with physical disabilities. 4, 2 appointed by the House and Senate ranking members of the Joint Standing Committee of the General Assembly having cognizance of matters relating to general law, each of whom is a consumer who privately pays for complex rehabilitation technology wheelchairs. 5, the Commissioner of Aging and Disability Services or the Commissioner's designee. 6, the Insurance Commissioner or the Commissioner's designee. 7, the Commissioner of Social Services or the Commissioner's designee. 8, the Healthcare Advocate or the Healthcare Advocate's designee. And 9, the Commissioner of Consumer Protection or the Commissioner's designee. C, any member of the Advisory Council appointed under subdivision 1, 2, 3, or 4 of subsection B of this section may be a member of the General Assembly. D, all initial appointments to the Advisory Council shall be made not later than August 1, 2024. Any vacancies shall be filled by the appointing authority. The Advisory Council shall meet at least monthly. E, the Commissioner of Aging and Disability Services or the Commissioner's designee and a member of this member of the Advisory Council chosen by a majority of members of the Advisory Council shall serve as chairpersons. Such chairpersons shall schedule the first meeting of the Advisory Council not later than September 1, 2024. The administrative staff of the Joint Standing Committee of the General Assembly having cognizance of matters relating to human services shall serve as administrative staff of the Advisory Council. G, not later than January 1, 2025 and annually thereafter, the Advisory Council shall submit a report on its findings and recommendations to the joint standing committees of the General Assembly, having cognizance of matters relating to aging, general law, human services, and insurance in accordance with the provisions of Section 11-4A of the General Statutes. Section 5, effective July 1, 2024. A, as used in this section, 1, complex rehabilitation technology wheelchair has the same meaning as provided in Section 1 of this Act, and 2, medically necessary means a written determination by a policy holder's healthcare provider that repair or replacement of a complex rehabilitation technology wheelchair is necessary to preserve the health of such policyholder. B, each individual health insurance policy providing coverage of the types specified in subdivisions 1, 2, 4, 11, and 12 of Section 38A-469 delivered, issued for delivery, renewed, amended, or continued in this state on and after January 1, 2025 shall not require a new prescription or prior authorization for the medically necessary repair or replacement of a complex rehabilitation technology wheelchair unless the original prescription is more than 5 years old. C, the insurance commissioner shall adopt regulations in accordance with Chapter 54 of the General Statutes to implement the provisions of this section. Section 6, effective July 1, 2024. A, as used in this section, 1, complex rehabilitation technology wheelchair has the same meaning as provided in Section 1 of this Act. And 2, medically necessary means a written determination by a policyholder's healthcare provider that repair or replacement of a complex rehabilitation technology wheelchair is necessary to preserve the health of such policyholder. B, each group health insurance policy providing coverage of the type specified in subdivisions 1, 2, 4, 11, and 12 of Section 38A-469 delivered, issued for delivery, renewed, amended, or continued in this state on and after January 1, 2025 shall not require a new prescription or prior authorization for the medically necessary repair or replacement of a complex rehabilitation technology wheelchair unless the original prescription is more than 5 years old. And finally, Section C, the insurance commissioner shall adopt regulations in accordance with Chapter 54 of the General Statutes to implement provisions of this section, approved May 28th, 2024. So just as a matter of reading that into the record for the purposes of the record of this committee or advisory council. So at this time, we will move on to nominations and a vote for the co-chair for the council. We will follow Robert's rules in this regard. We will take nominations, see if there is a second. We will then close nominations as appropriate, and then we will take a vote on that nominations as appropriate. Okay. So with that, I open the floor up to nominations for a co-counsel. Ms. Garland, yes.
Thank you very much. I would like to nominate Maureen for co-chair. Over the last few years of getting to work with Maureen, she has shown just absolutely exquisite leadership skills, clear, concise, and kind communication, beautiful attention to detail, gentle and yet firm dedication to the task at hand, regardless of what that may be, whether a large task or taking minutes, which she does voluntarily for all of our meetings, which is incredible. And also she brings just, lived experience to the table, which I think is important for both of our co-chairs to have. So I think that Maureen is a wonderful and obvious choice for a co-chair for this position with respect to all of our other nominees. I nominate Maureen.
Okay, Ms. Johnson seconded the nomination. Are there any other nominations for co-chair at this time? Okay, seeing none, we will close the nominations and we will take a vote. All those in favor of Ms. Amaral as co-chair of the committee, please signify by raising your hand or saying aye.
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 Okay, any opposed? Okay. Any abstentions? Okay, seeing none. Congratulations, Ms. Amaral. Looking forward to working with you on the committee. Okay, at this time, The next item on the agenda is a discussion of goals for this advisory council. I've taken the liberty of putting together a few notes. This is largely going to be, I believe, a data-driven group. We're going to be asking for data from particularly from the two vendors in the state. I think one of the things that we want to do in the short term is we have a report that's due in January. And as I see it, we're going to meet maybe 3 times between now and that and the time when that report needs to be written. So I think in the short term, we should determine what kind of information we would be looking for that would go into that report. What I'm imagining and thinking is what that report will largely consist of is an action plan for what we might be working on and focusing on in 2025, not taking anything away from what we might be able to do this year, but just again in the short term, thinking that report's got to be written sooner than later. Certainly as November and December come up, the holidays come up, and availability for everyone across the board will be less than ideal, less than it is now. So some of the things that I've come up with just as a launching pad for discussion, and then I'll certainly open it up to the floor. And again, some of these are things that we did work on, I think, in our previous group, but I think it's important from a foundational and a data standpoint that we do introduce some of this information into this advisory council so that we have it again as some baseline information going forward. So without getting into in no particular order, I think we should be looking at average transaction cycle time. I think particularly for repairs from maybe 2019 to 2024 that use the following metrics: initial consumer call to company return call, or initial consumer outreach to the company and their outreach back, their response, the time to schedule evaluation, evaluation to submission of paperwork, time to spec the parts needed for the manufacturers to quote, time for the manufacturer to provide the quote for submission to insurance, the days required to obtain the prescription or prior authorization, the time from approval of that to ordering parts, the amount of time it took to receive the parts, and then once the parts are received, the amount of time it took to then schedule the repair. Next item that I thought of was a history of what, general history of what occurred during that time period. Obviously, we know that we talked about it in great detail in those meetings that COVID and the pandemic had a great impact on their work from the top down. The third bullet point that I came up with: what has the industry done to improve the timelines to date, particularly not just in the last year, but particularly since the Public Act was passed. And then finally, what systems has the industry put in place to be compliant with Public Act 24-58? So those are the again the general bullet points that I've come up with as a means of things for us to look into. But again, happy to open it up to the floor for other comments, ideas, and suggestions.
So the statute, as you read into the record, already does provide, not exactly, but basically for the production of the data you said just now. But the statute, the way it's written, is an annual data requirement. And based upon, and others on the council can talk about this, we're already hearing lots of stories since July 1st of non-compliance, not even close to compliance. The assessment is taking place after 10 business days, which means it's impossible to comply with the statutory requirement of repair within 10 days. So your list sounded great, but I think that the real issue is frequency of the data for this council, that this, as the statute reads, we really can't do much with one report coming in on December 31st. And then the other thing I wanted to suggest with regards to the last, I agree completely on your list, but in the question of what are you doing to, compliance, is this really, really basic issue, as I'm sure you remember from the task force meetings. It's all about staff. It's all about tech staff. That's basically what it is. Other than the things that are outside of the industry's control, like prior auth and, you know, waiting on backward parts, which their own data shows is the minority of the time. It would be really good to get regular reporting on what they're doing to ramp up staff in terms of technicians so that they could actually comply with the statute.
Ms. Rascott, since you're on the call, I just wanted to give you the opportunity to respond to Mr. Taubman's comments, and if that's realistic, that we can ask or expect data on a more regular basis as a means of.
Yeah. Yes, because we are already doing it right now to be in compliance. The one thing I want to bring up, and I'm a little bit, you know, just because it's our first meeting, so I want to be respectful. But there's been stuff that's come out, a misunderstanding exactly of the policy too. And keeping in mind, this was based around the Medicaid lives. We have a lot of people that are dual and some timelines on some things. So, I mean, I have data already month to date once this went live. We're recording this with those aspects that are outlined in the bill. We had to be compliant to that. And how many of these orders missed those timelines? Did you get called back within a day? Did you get an evaluation scheduled in 3 days? If there was not a need for a prior auth or a script from, let's say, a Medicare plan, did we get it in there? Did we order the products? Did you get it fixed within the 10 days after that point in time? And so I just want to make sure the impressions out there that we're following those guidelines and the clients understand that too, because I've had phone calls that people didn't even understand their Medicare plan required a script on file, even though we have the Medicaid doesn't require that now, but they still have their primary that does. And timelines on that. So we're trying to change up some things. I know we've gotten some emails or letters that were not the most kind things about threats on voicemail systems, and we made some adjustments, even though it was for all public. I want to make sure we're very clear that everybody understands those timelines on that, and we're recording those right now. And I know the other providers are doing the exact same thing. So I asked those for feedback before this meeting. Do you have this? Are you recording this now? Are you tracking who and why? Because I knew in this first meeting I was going to be asked right up front. And we already have for the first month of July those numbers and going in where we got weekly reports that we're doing on this. And so, yes, I'm pretty positive both industry providers and the one other one, I'm not exactly sure, we'll be able to did that date more accurately, more monthly if it's needed, whatever it may be doing, we're tracking it now.
Is this information that you can disseminate to the advisory council, Ms. Rascott?
I think we can, but I have to make sure I get the data in the same format for both, because both providers have their own internal IT system. So I want to make sure the definitions line up the same, because I don't want to get in that same pickle that came across during the hearings before. But yes, we should be able to give you that way in some format. Because at the end of the day, you're going to want to know, okay, you missed this timeline. Why? What's being done? What's the reasons for this? I'm sure. And is it improving?
Right. I think that's correct. Mr. Taubman, did you have something further? Yes, sir.
Yes, that was a really helpful answer from Diane. So a couple of comments or questions. One is, I think you were saying, Diane, that that Medicare does not require prior auth. Traditional Medicare does not require prior auth for wheelchair repairs, but if somebody has signed up with a Medicare Advantage plan, they may require prior auth. Is that?
Yeah, it depends, but keep in mind, Sheldon, Medicare, fee for service, even Medicare, requires that you have a current script that's good for 12 months on file for repairs too, for continued medical needs. So it's basically a generic. And so if a client hasn't had one on file in the past 12 months for the continued medical need of the repairs, because that's a generic, we have to make sure we get that. So that might take a week or two to get it from the physician's office and get an updated script. We try to capture those with everybody at the beginning of the year. Every provider probably does it a little bit differently, but you've got to have a current 12-month script on file for CMS for repairs, saying medical need is still established. You don't have to get a prior auth. It is when a current script on file, it's still a need.
Thank you. And then the other thing is, with regard to the 10 days, I may have misheard you, but what the statute provides is 10 business days. And if you're waiting for prior auth, if prior auth is required and you're waiting for it, those days don't count. But otherwise, it's 10 business days. So it's not that once prior authorization is obtained, you then have 10 business days to repair it, because however many days it took you to actually do the assessment and get started, those days count as well. So you may only have 1 or 2 days left after prior auth is granted to complete the repair under the statute as written. I just wasn't sure if you were suggesting something different from that.
That's not how the statute's exactly, because let's go through that and pull it back up if we may, please. Because I had this highlighted, because this is something that we brought up. So if someone calls, I have 1 day to respond back. Once we respond back, I have 3 days to get that assessment done. Once we get that assessment, determining what it is that's needed, I have 10 days now to get that repaired. Barring there's no prior auth needed, no other script, and the parts are not on back order or anything like that.
Yeah, that's not what the statute says. At the end of the day, it says that you have 10 business days to repair it, and the only exception is that days waiting for prior authorization from an insurer or for delivery of necessary parts ordered for the repair don't count towards the 10 business days. So your description isn't consistent with section 1.5 in the definition section of timely repair.
Ms. Raska, do you want to review number 5 or?
Yeah, I'm looking at it right now.
Okay, I just wanted to make sure that we didn't lose you. That's okay.
No. I'm just rereading it.
And just to be clear, that's superimposed on top of section 2B that talks about the things you mentioned about, you have to respond within 1 business day after hearing something. You have to order parts not later than 3 business days after assessing the need. But that's all part of the 10 business days.
Agree.
I did have another question, which is not specifically about this. I wanted to ask what the industry is doing to educate their consumers about the new law, including the system of filing complaints with the Office of the Healthcare Advocate and that. What's happening with that?
Sheldon, I had a hard time hearing you. It's hard to hear you. So can you speak a little bit closer to the mic?
Yes, sorry, I apologize. I was asking what the industry is doing to educate its consumer members about the new law. And I also included in that the new law, which specifies that complaints should be filed with the Office of the Healthcare Advocate.
Well, we educate in regards to the timelines on those things that we're doing, and we're also any complaints that we receive, we log. Are you asking us now to also put a notice on their ability to go and file a complaint with the? Because if that's something you're asking for us to do, that's not something that we're doing right now on that component.
I guess my question is, what are you doing right now in terms of, are you telling them about the new law and the 10 business days and the 1 business day and that kind of thing?
Not necessarily, because we were trying to get it all scheduled in. So we have to comply. It's not a matter of whether we educate or not. It's a matter of we have to comply.
Okay, well, we'll talk about it later, I'm sure, maybe today.
Yeah, I want a little better understanding of that, because regardless of it, it's been enough that's been out there in the public. Pretty much everyone knows. Believe me, we're hearing it. And they're fully aware. So in regards to that, if we're supposed to go and educate additional, that's something then we definitely do need to discuss.
Okay, thank you. Michelle had something she wanted to say.
I don't know if this is right time to talk about this. I just found out that companies are treating scooter users differently. Can scooters be added? I don't know if this is right time to talk about this. I just found out that companies are treating.
That's a good question. I would have to look into that if scooters fall under complex.
They don't. I can tell you that right off the bat. Scooters are
Okay.
not complex.
Okay.
They're standard DME items.
Thank you, Diane. Appreciate it.
You're welcome.
So that would be a separate issue, not under the purview of this advisory council. But thank you, Ms. Johnson. Appreciate it. Okay, Ms. Rascott, do you think that there is a report or a presentation that you can provide at next month's meeting that would speak to where things are now, data?
Yeah. If I can probably pull up right now, like I had some data right now, where are we at, what was missed, why was a miss on some things.
Okay.
I think what we'll do is we do have some stuff like each is making what we call a Power BI report if anybody works with Microsoft.
Mm-hmm.
So we're tracking those days and times. What was the change in the date? If it wasn't within that 10-day window, why? If it's customer request because of change of schedule, if it because we were short-staffed or we missed it or why was it missed? That type of data. That is being tracked. So I think we could probably be able to give like a summation to the points that are outlined in the bill and hit those component points. I think we'd be able to give you a general summary overall where we're at and what's being done and what we have done since the inception of all this and what we're still doing and moving forward with.
Okay, I think that would be a great and reasonable starting point, is to plan that kind of a presentation for next month's meeting. And that will give us a sense of, again, what we need to put in, not only determine our work going forward, but I think also determine what's going to go into this report that we have due by January 1. So, does that sound reasonable to everyone here? Mr. Taubman, yes.
It sounds reasonable, but Diane represents only one of the companies, and they're not, New Motion, which is actually larger, is not here. So I don't know what that means if Diane does a presentation, but New Motion doesn't.
Sheldon, please note, I am working through our group through NCART and that to get this to consolidate our information.
She's working with them. She will get their information.
So just a more general question then, for purposes of this council, will you, Diane, be basically representing the industry?
That's the intent, because that's what you guys had on here to represent the industry. So I'm going to working back with NCART and Wayne in the group that was like in the hearings to make sure we have anything that's being requested for us. I will go back and reach out to them to get the data.
Okay, thank you.
Yeah.
I would point out that the industry did an excellent job. It was November 2nd of the task force meeting. The industry did an excellent presentation, including a PowerPoint. which laid out pretty much the data you were saying earlier. And also about the number of staff and that kind of thing. I think that was an excellent template. Thank you.
No, I agree. No, that was excellent. Okay, why don't we look then at scheduling the next meeting? I think typically what I would like to do next month will be an exception, but I would like to keep this the third Tuesday at this time, 11 to 12:30, if that is good for everybody. We will keep all the meetings hybrid, so if you can attend here in the LOB, terrific. If not, we'll have the hybrid option available for all of our meetings. That schedule may change as we get into the session and the hearing rooms are not as available as they tend to be. But at least I think through the end of this year, we should be in a good place. So I think I'm looking at the 24th of September for the next meeting. At this time, is that correct, Sean? That's what we were looking at. And at that time, we can get that presentation from Ms. Rascott and move forward. Yes, Ms. Garland. Right, I'm saying with the exception of next month, which I would need it to be on the 24th. No worries, no worries. So if the 24th at 11 a.m. works for everybody, is there any objection online from anyone? Okay, so we will schedule the next meeting at 11 a.m. on the 24th, and we will look forward to a presentation from the industry on where things stand now. And we can move forward from there. Does that sound good? Okay. All right, with that, and after that, as I said, we'll look forward to, we'll look at the third Thursday, because at that point, we're going to be looking near Thanksgiving, which is the fourth week anyway. So we'll try to schedule as best we can around those holiday times. Okay. If there's nothing else, yes, Ms. Amar.
So we would like to follow up on a letter that was sent to National Seating and Mobility, and I believe that Diane has received that letter. And also, again, to just continue or finish that conversation about communicating the law to the customers of both New Motion and National Seating.
So if I may, I would just say that there are several members of this group, this council, that were not aware of that letter. I would prefer that letter to be sent to the full group before there's any further discussion on it. We can certainly discuss it at the next meeting, but there are members of this council that were not aware of that letter. And I'd like them to have time to review it before there's any discussion in response to it, if that's
Absolutely.
okay.
Yeah. We will give it to Chandra. Yep.
Great, thank you. No, appreciate that.
And
Mr. Taubman, yes.
And to follow up on this question about what they're doing to educate, I didn't hear that from Diane that they are notifying their members in any way about the new law or about the 800 number email address for the Office of Healthcare Advocate. And I guess Diane asked me, am I requesting it? I'm only one council member, but I think that there'd be real value in that. And if in fact, I'm not sure I agree that everybody knows about the law. I've talked to many people who have no idea about the law. But to the extent that were true, then there's no harm in just the facts of just, short version of what the law provides. And then if you've got an issue, you can contact the Office of Healthcare Advocate.
I think that's something we can definitely discuss in the next meeting, certainly. Okay. All right, with that, I will entertain a motion to adjourn. Okay, is there a second? Okay, we will see you all on September 24th. Thank you all very much. Appreciate it.